Hi, my name is Kimberly Kent. I'm doing my persuasive speech on why vaccinating your child should be a parent's choice and not the government's. For 40 weeks, you have done everything you can to keep your baby you are carrying safe. You've given up certain foods, alcohol, you've changed your entire lifestyle to keep your unborn baby safe. You exercise regularly and make sure you're getting enough rest. You even have the option to choose a drug-free birth or a natural birth if you so desire. You've made all these decisions. However, within 24 hours after giving birth, you are told your hours-old child will need their first vaccine. You agree because you feel it's the right thing to do and it's mandated by law. And you've done everything right so far, so you choose what you think is best. But is it? In 1850, the first school vaccine mandate was put into effect in Massachusetts to prevent the spread of smallpox. By 1980, every single state had vaccine mandates in place for school-aged children. 6 years later, in 1986, the National Vaccine Injury Compensation Program was established. This was a fund to shield pharmaceutical companies from lawsuits that were caused by vaccines manufactured by them. Instead of going to trial, you would go to what is dubbed as vaccine court, which is paid by taxpayers and not the pharmaceutical company. This should have raised red flags for parents and for pediatricians, but instead the amount of vaccines for children actually increased. In 1980, an average child received 12 shots with 25 antigens for 8 diseases from the ages of 2 months to 14 years. Children in 2019 received 54 shots from birth to 11 and a half years of age. So how did we get here? Money. Each pediatrician is offered an incentive program. So for example here, I'll use Blue Cross and Blue Shield. So for each child they vaccinate, they receive a kickback from Blue Cross Blue Shield to their practice. For example, a practice could receive up to $40,000 a year in bonuses if they have 100 patients vaccinated. In an excerpt from the 2019 Blue Cross Blue Shield of Rhode Island brochure sent to physicians, one of the questions that was asked is, what if the patient refuses to do what we order or request? Blue Cross Blue Shield's response was, we recognize that many factors influence patient adherence to recommendations. There may be clinical reasons why some patients may not receive the services suggested by the general guidelines. Patient choice and patient-specific clinical judgment remain essential. Payout targets reflect these factors as they are benchmarked against national comparisons. We do hope, however, that you will address barriers to care with your patients. As appropriate, seek assistance addressing these barriers by contacting Blue Cross Blue Shield of Rhode Island's Care Coordination Program by calling 401-459-CARE. So, upon reading this, I decided to research a little bit further. So, if that didn't grab your attention as a listener, maybe this will. If you were to ask that same physician what is in the vaccine you're about to give your child, they will tell you preservatives to prevent contamination, adjuvants, and stabilizers. But as a parent, you want to know exactly what those are. So the doctor looks at you, kind of panics, stammers, and doesn't really say anything. And how do I know this? Because I've actually been there. To quote Dr. Ramos, MD, the only thing we learned in medical school was that there was a program and that we should follow that vaccine program. As to the vaccine itself and the contents of the vaccines, no, we didn't study that. I found half a dozen on-the-record quotes almost identical to this one from board-certified physicians that attended different medical schools throughout the country. So just a little quick rundown of what is in some of the vaccines that are given to your child. We have aluminum hydroxyphosphate. People with higher levels of aluminum in their brain tissue are those with Alzheimer's, autism, and multiple sclerosis. Non-viral protein, it's also known as DNA. FDA has acknowledged that as residual human DNA that has the potential to cause cancer or to change one's genetic code. And finally, formaldehyde, which is a known carcinogen according to the American Cancer Society. For my Trust the Science friends, let's take a look at VAERS. So this is a vaccine adverse reporting system. It's a reporting system through the CDC that allows for anyone to report vaccine adverse reactions. So one of the ones that I decided to research for this particular speech was the first vaccine that a newborn child is given, which is hepatitis B. So the mortality rate for an unvaccinated child who gets hepatitis is 0.3 to 0.6%. The mortality rate of the actual vaccine itself is 0.17%. This is not something that the pediatricians or the doctors or the nurses in the hospital tell new parents. And one last thing, at a November 2012 congressional hearing, the CDC failed to supply even one case study showing vaccine safety for children. 11 years later, there still is to be one case study presented to prove that there is safety in the vaccines that we're giving these children. As a parent, this is why I believe parents should be able to choose whether or not they want to vaccinate their children and not the government. Thank you.